Okay, I make it 3:15, so we will get started again. Hope you all enjoyed your break. We now have Grace O'Driscoll, and I will hand straight over to Grace for her session.
Hi, everyone. I'm Grace. I hope you all had a good short break. And I'm going to talk about critical race theory as a framework for decolonisation. I'm just going to turn my camera off and go through the slides. There's a lot to get through, so I'm not sure I'll have time for questions at the end, but I'll try my best. So at the outset, what I'd like to say is thanks to the CALC team for putting on the conference and creating a space to present my work today, and thanks to everybody who's here. I'd like to recognise that as a white library worker and researcher, I occupy a position of embedded advantages, and for me that includes economic advantages. For instance, I have retrained and changed career into the library sector coming from a background in retail buying. The study I'm presenting today has limitations, and these include my own lack of lived experience in being minoritised. The content also includes some stark figures and facts around health disparities during the COVID pandemic, and I wanted to highlight these in advance. So this talk documents my learning experience. It isn't positioned as expertise, and I hope it's very accessible and encourages others who are new to the sector or new to decolonisation or anti-racism to engage with critical race theory. The presentation is based on some research originally done for my master's dissertation, and it's progressed through several iterations since, including a journal article. And experts who are referenced throughout will be clearly signposted, and the references will be available to download. Looking at the agenda, I've done the introduction. We'll look at some background in terms of COVID-19 and the transparency it created in healthcare information. I'll touch on Black Lives Matter and the impact it had on institutions, and I'll try to place critical race theory in context for decolonisation. I'll then be moving on to the basics of critical race theory as a framework, looking at how applicable the tenets are and how they can be defined in information work. And as part of this, I'll be looking at my original research findings, like how the CRT tenets were used for the analysis of my literature review and how the survey and interview results fit in with that. And finally, I'll be looking at how I collated my research themes and the CRT tenets to identify some opportunities for practice. So some key elements of the background slides might be very familiar to many of you, but I felt it was important to make the context clear and to remind ourselves of some of the things we've learned over the last couple of years. One of the pieces of data that made racial health disparities so transparent during the pandemic was the disproportionate risks of infection, including the risk of death, to racially minoritized healthcare workers. Minoritized healthcare workers faced greater risks, not just compared to the wider population due to more exposure at work, but compared to white healthcare workers in similar roles. Looking at this disparity particularly partially addresses some of the more pernicious, dismissive, and racist assumptions that have prevailed in past research into health disparities. For example, assumptions that communities have been hard to reach, have showed poor compliance, have been vaccine hesitant, or have had poorer diet. These biased assumptions are harder to apply to healthcare and clinician groups. Disparities during COVID illustrated more relevant factors and socioeconomic realities. For example, racially minoritized healthcare workers being more likely to be stuck in frontline roles. The interpersonal realities of bias, for example, difficulties accessing PPE or not being listened to when raising concerns. And in addition, for many workers, predispositions to underlying health issues or housing conditions due to wider socioeconomic factors associated with race. And I've just realized that my slides are not scrolling on, apologies. So awareness and transparency of the higher risks grew across both the mainstream press and academic publications, here appearing in The Guardian in 2020. And also in academic professional healthcare publications at the time, there were highlights of the root causes of ongoing underprovision and resultant poor health outcomes and heightened risks. For example, Otto et al. Pointing out that Public Health England's report on disparities had no proposals for actions or mitigations to reduce these disparities. And even with awareness growing, there was reproduction of racial underrepresentation and ongoing underserving of Black and minoritized people in research and case materials. For example, research came out with no visual representation of skin-based COVID symptoms on darker and diverse skin tones, risking ongoing substandard care. In the midst of pandemic 2020, the Black Lives Matter protests prompted statements and commitments in solidarity from many institutions globally and in the UK. This included most health and education institutions. Here we see an NHS communication of solidarity from Simon Stevens, then the NHS CEO, announcing the launch of the Race and Health Observatory. In my research, Black Lives Matter in 2020 seemed to have consolidated some action on what COVID was already highlighting. And here a statement from the General Medical Council committing to increase diversity in teaching materials in medical education, following pressure from student groups and successful online petitions. Critical race theory particularly highlights the gap between intention and impact. These statements would need to generate operational action to be sustainable or to be measurably impactful. It's the impact that counts, and what we're seeing here is just intent. And many of 2020's anti-racism statements were predated, as you'd expect, by health bodies' policies on equality, diversity, and inclusion. There was already clear intent to address health disparities. For example, here is Public Health England's 2018 commitment to reduce health inequalities. And here, NHS 2015 policy statement regarding the need to reduce disparities. And here's Health Education England's clarity on the legal duty to provide equality of service. Despite these commitments and intentions, persistent health disparities continue and continued, amply illustrating the ongoing gap between the intent of the policies and the statements and their lack of impact. Within this background, student voice was a growing force for change. Diverse cohorts attempted to decolonise medical education and set this out as a springboard for equality in medical care. Bristol Medical School took a lead in curriculum decolonisation, and the medical student petition calling for representation in teaching materials was successful in encouraging the GMC to commit to changing curricula, as mentioned in slide 8. We also saw Malone McWonday, who was a second-year student in medical school at St George's University in London at the time, who created Mind the Gap, a handbook of clinical signs and symptoms on Black and brown skin. This book was authored outside of the mainstream academy and core publishing. It's available open access, and it garnered worldwide attention. This one book had significant impact on awareness, and within 2020's wider movement for change seems to have prompted some ongoing inclusive practice in mainstream publishing. But the issues go way beyond symptoms on skin and what one visual handbook can achieve. Taking the conversation back to library and information work, various iterations of decolonisation, critical librarianship have been going for some time, extrapolating from earlier established premises of the common good. These range from online community movements like critical cataloguing and critical librarianship to activism like the campaign documented in the film Change the Subject. However, some structural and systemic changes have been grindingly slow. The profession remains overwhelmingly white, barriers to entry remain, classification schemes and subject headings, especially in healthcare information, remain outdated, exclusionary in both language and concepts. Meanwhile, culture wars and wider issues of inequality, bias, socioeconomic barriers, they're replicated in information environments. We're not in a bubble. There are ongoing critiques of lack of action and impact in library and information work. Most of us are familiar with Fabazi Itar's 2018 essay calling this out. Her critique of vocational awe resonated with many people, expressing frustration with the assumption that libraries and information services are all good. Other authors highlighted perceptions of critical librarianship as being performative, exclusionary, inaccessible. These sorts of experiences and perceptions carry a risk that many library and information workers and students could or would participate in critical or anti-racist practice, but become engaged or disengaged potentially. We need to keep pushing on with accessible actions, not just awareness. Much of the leadership and scholarship on CRT and critical librarianship has come from the US, but UK voices of leadership are emerging. And I wanted to share some examples of UK librarian voices that influenced my progress as I learned more. During my dissertation research, Ramona Nyker's explanation of the extent of underrepresentation and systemic racism in healthcare research and some of the information service accountabilities in critically appraising for this was a key turning point in my understanding of systemic racism's impact and roots in medical research and publishing. Ramona's critical appraisal tool for anti-racism is available online and it's open access and the details are in the references. Similarly, more recently, I attended Naomi Smith's groundbreaking UK-based webinar on digital decolonisation, and that was attended by a global audience, which was a big change. Some highlights for me from Naomi's introduction and concluding remarks included a call for the use of direct and uncompromising language, something I've really had to learn to do more. This was a reminder to deal with issues of racism and exclusion. We need to name the problems clearly and specifically. An example of this, during my journal article peer review process, I was encouraged to accurately use the word racist to describe a troll who responded to my dissertation survey. Previously in the dissertation, I'd used softer, more compromising language, and this was a key learning point for me. Naomi also raised the importance of white colleagues and professionals leveraging our privilege. The reality is that we'll experience less pushback, less defensiveness, less eye-rolling compared to minoritized colleagues, and in particular compared to Black and brown women who raise issues. We can speak up about issues and take on roles to pursue equity and anti-racism safely. These points are particularly clarifying, but also particularly encouraging. So looking at the place of critical race theory within library and library and information work. Again, we're not in a bubble. I wanted to highlight some divisive and misleading rhetoric and reporting around CRT. It's been around for years and it's mainstream in US media and politics, and it's definitely entered the discourse and reporting here in the UK. A key component of this culture wars style backlash on CRT is misrepresentation. Critics claim inaccurately that CRT says all white people are racist or that it's an attack on history. And as mentioned here in The Guardian, this backlash is in avoidance of and distraction from the work towards cultural and systemic equity and accountability. A moral panic rhetoric runs the risk of putting institutions and individuals off using CRT or even considering using it in their work. And it makes it harder for people to speak up. So it's even more important to speak up and correct these misconceptions. The backlash continues and it gathers pace despite CRT's accepted position in legal and educational policy development. It's proven for examining inequity as opposed to equal opportunity, and that's exactly what we need to be working towards in decolonisation work. It damages the credibility in a tool that we could be using. So what's the case for using critical race theory in library and information work? As I mentioned, it's established in the education sector policy, not in schools as some media would claim. Library and information work is closely linked to education. A lot of us work in educational settings, so it makes use to share some policy frameworks and tools. As we've seen, decolonisation is an ongoing work stream, and therefore it's an important facility for us to have. CRT is also now supported by a core library and information text, which I'll have a look at on the next slide. And that means it can be taught in library master's courses, and it's also there for our reference. So the text is Knowledge Justice, published by the MIT Press in 2021 and authored by Sophia Lung and George Lopez McKnight. And it really examines and reaffirms the place of CRT specifically within the information domain. Within the text, some tenets of CRT as applicable to libraries and to information services are listed and thoroughly examined. I'm not going to go through these individually at this time, but I highly recommend accessing even just this one chapter of the book. It's freely available online, and again, the details are in the references. So going on to looking at the research project findings. Within the research, which was for a master's dissertation, there was a literature analysis looking at all of the background of social justice within librarianship, collections management, and also at critical race theory. A survey of NHS healthcare librarian workers. I had about 32 responses, and interviews with healthcare information workers, getting their feedback of experiences doing anti-racist work and experiencing EDI initiatives. I'm showing this table for illustration purposes, really, just to show how the CRT tenets started to shape the project. I pulled out recurring themes from the literature review and assigned the themes to the CRT tenets. This helped me to sketch out and understand the breadth of each tenet and how it applied to the themes. In a practice setting, I know there wouldn't be this much reading involved. As opposed to an academic exercise, the reference literature would be fewer, but the survey and interview results or practice-based objectives and observations could be added to the table. What the CRT tenets really usefully facilitated here was the drawing of themes and findings together into cohesive arguments and action plans. It avoided me settling on orthodoxies or assumptions that would be limited by my own biases and helped me to look deeper and wider at what was really going on. Then looking at some of the more direct findings, I won't go through all the research, but I've selected some more interesting results. My survey findings included that most information workers believed that they could contribute to health equity through their own work. Interestingly, there was also some correlation between involvement in wider EDI activities, including diversity work, and this belief. So the more people found out and got involved in anti-racism, the more they believed it could be effective. Looking at participant experiences of EDI initiatives, the survey found that the predominant focus of anti-racism work in healthcare libraries, and I think in libraries more widely, was staff diversity, in addition to text by more diverse authors being added to the collections. Participants related very little exposure to the sort of systemic bias checking highlighted by Ramona Nyker's work, or to any clinical focus at all. There were also some very informative comments coming through in the free text fields, with one respondent commenting that their service were even unclear how to best diversify the collection or how to evaluate that. When asking about awareness of the General Medical Council statement on increasing diversity and representation in medical school curricula, there was a really disappointing level of awareness. Around a third of responses were aware of the statement and commitment. How is the more representative material going to be included in curricula if libraries and training institutions are even unaware of the commitment to provide this? And even where it was promoted, it was highlighted more to medics than to students. It shows a disconnect between the intent of the GMC and their ability to impact or even to communicate their intent to the teams who would need to provide that information if it was required. There was better awareness of the resource Mind the Gap, but there was still a shortfall in promotion to students. Comments really varied between positive and highly engaged resource provision to much more hesitant, and it perhaps indicated a nervousness about grey resources that were outside of the core publication system. And there was some confusion about who it was relevant to, with some services highlighting that they had promoted it to their BAME networks. And actually, it's a clinical resource for all clinicians. It isn't really just something that needs to be promoted to the racially minoritized members of staff. Before I move on to any interview findings, there was one thing I'd like to mention regarding the survey. The data excludes a racist troll response I received, and that attempted to skew the data by answering a lot to all of the EDI-based questions. The response also included some trope phrases about social cohesion and cultural Marxism that made it really clear what perspective it was coming from. And this illustrated really effectively the risks of environments expecting people to speak up, because the potential effect of having received such a racist response on myself would have been much more negative and much more difficult for a minoritized researcher. So I wanted to highlight that experience. Moving on to the interviews with practitioners, these confirmed and fleshed out the survey results. They highlighted clear barriers where there is engagement and intent to diversify collections, but some lack of progress due to lack of guidance, lack of confidence, and to individuals each having to attempt to decolonize their own settings collections. The interviews also highlighted underlying drivers of information deficits, again, the poor support from publishing and research, and also multiple racisms in play, systemic, institutional, and interpersonal, all having an effect. However, there were also strands of assumptions around diversity that were concerning, with diversity of both people and resources being perceived as potential solutions and not just elements of the EDI work. Diversity is obviously valuable work, but it can't be the solution, and we can't wait for it to happen before we make other progress. As a last step before drawing conclusions and recommendations, the findings across the literature review and the survey and the interviews were again put through the CRT tenets and organised and collated. I won't read through all of these, but you can see how the analysis becomes more refined and more action-oriented as this process is followed again. This then led to a series of recommendations, and would in a practice environment really be an action plan or the beginnings of a strategy. Before I move on to listing some of the opportunities identified, I wanted to preface it by recognizing that the recommendations here are not actually that radical or disruptive. They're well within the grasp of the existing systems and infrastructure. A really meaningful point made in Naomi Smith's webinar is how we're using the word decolonisation. And a lot of this falls well short of any decolonisation. It's not about dismantling and rebuilding any structures. It really is the bare minimum for an effective and operational service that reflects our population diversity as we have it. Really, these types of recommendations are going to deliver efficiencies because it's making the integrity of the information better, it's having accurate and full coverage for the users. So the kinds of recommendations that emerged from the project were centralized guidance. It really feels like decolonisation is something that's being reinvented in many, many locations and often by individuals. I guess I'm questioning in this whether it's part of the slow rate of progress. We recognise that there are best practice frameworks for all areas of our work, but then we're not leveraging our institutional networks or our wider organisations for decolonisation. Diversity, we really need to disambiguate diversity from the scope of responsibility for equity work. This means making sure we're not placing expectations for achieving decolonisation or anti-racism on those who embody diversity within organisations. In addition to experiencing and compensating for marginalisation in their own progress, we then ask marginalised workers to do more of that work. The work belongs to all of us. It's about information integrity. Data management standards in research are an ongoing work in progress with regard to race and health data. COVID-19 did shift the paradigm. Inclusion of race-based data where relevant to disparities is now recognised best practice, but there's so much work to do. The research and publication landscape has also shifted a little, but information practitioners can drive and lead here as well. We're the customers of our publishers, and coverage is not adequate yet. We need to keep asking for more. It's also not clear that the information landscape in medical education has changed at undergraduate level or at continuing medical education level, or that resources are being made available to support this. And finally, gatekeeping and barriers to global scholars and clinicians to participate in publishing and research. Despite the rich opportunities for knowledge sharing, too much research is being led by and focused on the West and the global North. Research librarians can help to influence some change here. So that's it. I hope it's been an informative session and that anyone who was not familiar with critical race theory or who has decolonisation or anti-racism projects in progress might be encouraged to take a look at some of the writings and tenets to see if they might be helpful in expanding or in guiding that work. It's something that I'm hoping to do in the higher education library I'm now working in. And I'm also progressing other projects, further research work, participating in some research work that other people are doing. And also I'm interested in hearing about ongoing or future work that others are involved in. And I'll be continuing to follow some of the leading UK voices that I mentioned and others who emerge so that I can keep on learning myself. Thank you very much to everyone who is still here. I think we've got a couple of minutes for questions and I'm going to be brave enough to open the chat.
We do. We've got one question so far, which is, this is an academic exercise. How do you think it would work in practice?
Yeah, I think, as I mentioned, would be a little different. There was, as a dissertation, there was a lot of reading involved in this particular exercise. I think that some of that reading would be necessary, but some could be replaced by, you know, in situ action plans, by direct surveys of users, because every piece of data that was gathered here was gathered from professional staff. So I think that the content would be different, but the framework could very much remain the same. So using the CRT tenets as a framework, listing them out, finding the best supported elements, and using those to form an action plan would be the same, just the inputs would be different.
Brilliant, thank you. We've got lots of thanks and some resource sharing going on in the chat. I don't think I've seen any other questions, but we do still have a few minutes. So if anybody would like to either raise your hand or ask a question in the chat, please feel free to do so. Darren, why did I know you'd have a question? Go for it.
I do. I guess what I was just interested in is you said that you did this as part of your master's study. How well supported did you feel in using CRT as a framework for a master's dissertation in terms of your supervisory team?
Very supported by my supervisor, and actually the following article was co-authored by my supervisor. That was David Bolden at City. But in terms of my progress in the dissertation, I feel I happened on CRT quite late in my process, if I'm honest with you. It wasn't something that I had visibility of when I started work. And that's why it was maybe a little disjointed in having to go back and retrofit it to the themes for the literature review and then take on a kind of a whole new strand of reading. So I don't think CRT has been particularly visible in library work. I think that I hope has changed significantly with the publication of the book. And I hope that awareness is growing, but I think I quoted a 2018 study by Gibson saying that hardly any library science courses were including it as a framework for the domain. And so I think that's where one of the start points will need to be, alongside more people using it in practice. And I think while the media are disparaging critical race theory, that's what needs to be fought against.
That's brilliant. Thank you.
Yeah, just to follow up on that, I think it's really interesting. I completed my library degree almost 10 years ago now, and there really was very little kind of social justice element to it. I think maybe we discussed it in the public libraries module, and I think it's quite kind of encouraging to see the progress sort of since then. There's been a lot more discussion. Sounds like a lot more is happening in library schools as well, so I think that's really good.
Yeah, certainly my experience was there was a huge focus on ethics and integrity. So where CRT wasn't covered in depth, the expectation for social justice work definitely was, and it was more incorporated in modules rather than being pulled out as something separate.
I was just popping into the chat. I was wondering if we had any current LIS students in the room, and whether it is being covered. I mean, I'm a student in the sense, but I'm a PhD, and it's something that's come up as one of the frameworks that we can use. But but obviously that's not within a module or anything.
Hopefully, the more people talk about it and the more people recommend it, it will start to become one of the tools. I mean, there are so many frameworks and so many process-oriented approaches to librarianship. It seems remiss for there to be something really helpful out there and it not to be covered as a basic.
Yeah, I totally agree.
We have a double module on management and corporate management theories, so I'm not sure why that was more relevant than anything else.
I think no matter what library environment people are graduating into, it seems highly likely that decolonisation, whether we're using that word correctly or not, is going to be one of the work streams. And so it just seems that equipping people for that, when there's something sitting there really, really usefully. I mean, as somebody who was quite naive and unaware of structured approaches to racism and of systemic racism, I found it incredibly helpful. And I think otherwise, I don't know how I would have organized my thoughts and my findings in any effective way. I think I would have stopped way shorter of where I did get to by having it there to help. So I think that's one of the big reasons I would advocate for it, that it simply works, and there's nothing scary or difficult about it.
Yeah. Okay, that's brilliant. Thank you so much. It is dead on time now, so we will finish there. So we've had lots of thanks in the chat already, but please do take this opportunity to thank Grace again for that really fantastic session. Thank you, Grace. And we will finish there. We will have 15 minutes break and we will come back at 3 o'clock. So thank you.
Thanks so much, everybody.